Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
Welcome back to the Tech Talks Daily Podcast, where every day we explore the impacts that technology is having in areas that you don't always think of. Now, as regular listeners will know, I am armed with a curious mind and I enjoy virtually drifting like Kane from Kung Fu, getting into adventures and mischief along the way. But seriously though, I've had a nasty pain in my shoulder for the last 10 months and I've developed a slight lump on the top of my shoulder and just seems to ache and hurt and a bit of discomfort when I sleep at night. So getting a medical appointment this year has been notoriously difficult, and I did end up having an x-ray which didn't pick anything up, but I still have a pain and I still have a lump on my shoulder. So a little Googling later, I thought maybe it could be the rotator cuff or some kind of inflammation there. But before I knew what was happening, I ended up discovering a world of opioid addiction, and how Dr. Sean McMillan, an orthopedic surgeon, was specialising in alternate treatments to opioids and working with a team of, I think, over 400 doctors called the Army of Warriors, who were seeking to end opioid addiction and also piloting Avalon.AI, which is an AI platform to assist in opioid detection and treatment. And it occurred to me that this is probably an area that we don't talk about very often, because there are people out there having hip replacements, knee replacements, who have never taken any form of medication and slowly becoming dependent upon it. So how is tech helping with opioid detection and treatment? Was it enough for me to take my mind off my own shoulder for a few moments and stop feeling sorry for myself and hear more about how the kind of difference that technology was making? So buckle up and hold on tight as I beam your ears all the way to the US so we can speak with Dr. Sean McMillan. So a massive warm welcome to the show, Sean. Can you tell the listeners a little about who you are and what you do?
Thanks, Neil. My name's Sean McMillan. I'm an orthopedic sports medicine specialist, part of Virtua Health Systems in South Jersey. And really, I specialize in minimally invasive ways of fixing injuries to the shoulders, hips, and knees, like rotator cuffs and ACLs.
Wow. And many people would have been affected by lengthy lockdowns in 2020. So I've got to ask, can you share how many Americans are turning to opioids as depression and anxiety worsened during the pandemic? Because it's been such a challenge for so many people, hasn't it?
Yeah, the opioid pandemic really was sort of missed or sort of put to the back burner during the COVID lockdown, as rightfully so. A lot of the attention was placed on COVID. But there's been all these reports that have been coming out in the last several months looking at the effects of what COVID did to patients, and they're turning to opioids. And many patients have turned to opioids because they're having pain that just couldn't get fixed due to the pandemic and surgery shutdowns. But other patients are turning to it as a way to escape, whether they're in isolation, they're depressed, they're looking for a way just to sort of feel better because there's a lot of things going on out of their control. So it's multifactorial, and it's something that we as physicians really need to pay attention to and ask the right questions when we see our patients.
And despite that growth, am I right in saying that many US treatment centres are still shut down or turning away patients that are suffering from opioid addiction? Is that right?
So certainly during the height of the pandemic shutdown, there was a lot of shutdown of all sorts of institutions, and that included opioid clinics and support groups. So it's been disjointed at the very least, I would say. I know that everyone has really tried to get this back up and rolling, but without that steady 24/7 support that they're used to and that patients need, it certainly is not where it needs to be at right now.
And what do you think the cause of opioid addiction is essentially in America? Is it just a symptom almost of the lockdown, or is there something else going on there?
So again, I used the word multifactorial before, and every patient's different. And I want to be really careful not to just pigeonhole, patients. Sure. When you look at, in my world as an orthopedic surgeon, about 16 to 18% of elective hip and knee replacements end up needing opioids or becoming dependent upon them afterwards, meaning they weren't on opioids before, and yet they became addicted because of the pain associated, and it became easy to use the medications in what they thought was the right way. But then the patients start to determine that, hey, I need this a little more than I should, or the body starts to crave it. The flip side of that is patients that are maybe more predisposed to depression or have a need, a chemical imbalance per se, to fill a void. And those are a separate set of patients that become addicted to opioids, in part because they're so easily available, and in part because they do serve a role in the chemical pathway in the brain. So it's important for us as we electively treat our patients to make sure that we're not overprescribing. And for patients that maybe have needs or maybe are going through a tough time, we need to actually ask the questions, how are you dealing with this? And if a patient reaches out for help, or if there appears to be a pathway that we identify in our opioid checking of patients as we check their pharmacy records and make sure that they're not overprescribed, we need to step in and say, here's how we can help.
Well, a huge thank you for patiently setting the scene there. And the reason I did that was because this is a tech podcast, of course, but I think all too often we see companies or individuals going straight into technology first and then trying to fix a problem, whereas I always try and start with the problem first and then look at how technology can help. And we do often hear about the dark side of artificial intelligence and big tech, but what positive role can AI technology play in helping people in situations like this?
Yeah, so it was interesting when I first learned about Avalon.AI. My first thought was, how can AI technology help me as a surgeon? I think that I take good records, and I think that I'm doing a good job of being proactive with my patients. And then what I started to learn was, quite frankly, there's so much that goes on and so many touch points for patients outside of my interaction with them, whether it's seeing a physician, their primary care doctor, another specialist. The pharmacies that they go to, they might go to multiple pharmacies. So these are all things that I didn't realize that were there. And using AI technology can allow for us to sort of monitor and change outcomes in the future, as well as also offer real-time analysis for myself as a physician and for the other physicians managing the patient to say, look, this is what's going on. Here's the medications our patients are on. And really, are we doing the best possible job? So AI technology is both real-time as well as predictive. And what I mean by that, Neil, is simply, if I do your rotator cuff, I'm going to have this litany of data behind me that says, look, over the last 100 rotator cuffs in a patient of your size, your weight, your needs preoperatively, this is how much opioids you should require postoperatively. And it'll allow me to predict what's needed. And if we're starting to stray from that, it's going to send a flag up to both me as well as the other providers involved to make sure that we're giving you the best possible care. And maybe we need to look in a different avenue to find a way to provide pain relief.
And for people hearing about Avalon.AI for the first time, can you just walk me through exactly what it is and the kind of problems that you're solving with it?
Yeah, so Avalon.AI is a technology that was founded basically to help monitor outcomes. And its primary goal is to help monitor outcomes and record data in the opioid field. But again, this can be used in other metrics as well. And that's where I think the future is heading, such as patients with cardiac disease, patients with cancer or diabetes. We can make sure that we're providing the most optimal care now and help predict in the future what their needs are going to be. So that way we can cut out some of the trial and error that we've seen in the past with patients.
And can you share how doctors are using Avalon.AI for opioid detection, just to, I suppose, really help people understanding the kind of difference that it can make, especially if we've got any healthcare professionals listening?
Yeah, so there's many things that are in place already that monitor opioid prescription. For example, in my state of New Jersey, we have a monitoring system. So I can go online, Neil, and I can put your information in it, and I can see what medications you're taking, and I can see who's filled them and when they were last filled. But that just sort of tells one part of the picture. Sort of the niche behind the Avalon.AI platform is it's going to allow us to aggregate data from multiple health systems in the area, multiple providers in the area, and look at how they've been prescribing both before, currently, and how they change predictively in the future. And as I mentioned, we want to make sure that we're able to sort of monitor, where we've been and where we're going with this. And the best way to do that is to say, in a patient such as you or Mrs. Jones or Mr. Jones, what are their needs going to be ahead of time? So I can look at you, Neil, and say, based upon this aggregate of data, you're probably only going to need about maybe say 10 Percocets after your rotator cuff surgery. And if we add in these other medications as well, we know that you're going to be able to get you through the hump and you're going to be okay. And you're going to be able to have a good outcome. And here's when we think your need for narcotics are going to decrease, whether it's 4 weeks, 6 weeks, whatever it may be down the road. And that provides data both to the patient as well as myself, the provider. And it really gives you a bit of comfort. So that way you know what to expect on your end as well as mine.
And what I love about this story is how you and a team, I think of 400 doctors that call yourselves the army of warriors, are essentially leveraging the best of people and technology to solve a real problem. Because I do often see people going, like I said a few moments ago, just tech only, but it's the combination of the two. That's where the real problems are solved. But I've got to ask, what was the story behind the company and how did you get involved?
So opioid sparing surgery has been a passion of mine. It's something that I've been involved with for the last several years, as well as several other surgeons. And again, it sounds silly, but it's a matter of taking responsibility and ownership for not only fixing you physically, but also fixing you and protecting you when it comes to the opioid and other medications that we use to make your pain better. And as you start talking to colleagues, and I started speaking to different colleagues, we started trading ideas. What are we doing differently to, give a patient a same-day surgery, for instance, meaning I can replace your knee and you can come home the same day. What are we doing to provide pain relief so the patients aren't, god awful pain and having slower rehabs afterwards? And as you started trading these bits of, here's what I'm doing, here's what you're doing, these little tidbits, we found that there's a lot of common ground that's available. And then we said, well, what do we do with some of this technology? And Avalon.AI was a platform that was out there that was introduced to several of us who call ourselves opioid sparing surgeons. And it's something that made a lot of sense for us because it provided real-time and true statistics for us to be able to see what we've done so far and how we can get better when it comes to minimizing pain relief, but optimizing outcomes. One of the things that's important to understand, Neil, is, and this is something that I really emphasize to patients, is when we say that we're opioid sparing surgeons, it doesn't mean that we want a patient to suffer, and it doesn't mean that we're not giving opioids out. It's quite the contrary. It's like everything else in life. We're making sure that we give you the best possible outcome. So that way, when I give you your opioid post-surgery, we're making sure that we give it to you in a way that's going to be most effective. We're not abusing it. We're not causing you to have a slower recovery because you're sluggish or constipated or dependent upon the medication. We're optimizing what the med's used for, getting you off them as quickly as possible, and providing you with the best possible outcome.
And what kind of feedback have you had, both from the medical community and patients alike? Do you get to hear any feedback?
Yeah, we do. And it's amazing. Opioids, it's something where for a lot of patients, it was almost like it was a stigma for a long time. Patients didn't want to say, listen, I have a fear of surgery, not because of the surgery, but because of pain afterwards, or because of the risk of addiction, or I have children at home and I don't want those pills in my house. Or maybe there was a relative or a friend who, had an elective surgery and then got addicted to pain meds and went down a very bad spiral. That scares patients. So as, we've sort of focused on becoming opioid sparing and gotten the word out amongst patients and amongst social media, we actually have patients seeking us out and saying, you know what, I'm so glad that you focus on, opioid sparing surgery, or at least, focus on making sure that I'm going to be safe because I put this off for so long because of those previous fears. And then our data speaks for itself. We published papers looking at opioid sparing surgery. We have a paper that came out of our institution here in Virtua in South Jersey looking at rotator cuff surgeries. And that's one of those surgeries where typically people were using somewhere between 40 and 60 opioid medications after rotator cuff surgeries. And by using a multimodal approach, meaning using different medications that are non-narcotic in nature, both pre-surgery and post-surgery, we got that number of rotator cuff medication opioids down to about 2.5 pills over the first 7 days. So it was a marked reduction and something that we've been able to maintain and reassure patients before surgery and afterwards that, hey, we'll give you a good outcome without a need for a lot of narcotics, without a need for a lot of downtime from the narcotics. And really, patients have thrived on this, and the word of mouth has been incredible.
And if we look at the AI element of Avalon.AI there, presumably it allows you to unlock insights that were previously unavailable because it was just those mountains of data, and it takes AI to get those insights out. Is that right?
Yeah, it's amazing how much data is there if you just look for it in the right spot and you're willing to be honest with yourself and open up. As a physician, one of the things that we need to realize is we're not perfect, and we need to take accountability for what we do. And Avalon.AI, in working with these multiple institutions, they're currently working with 7, going to be up to about 15 or 20 by the end of the year. As they get all these institutions on board and have privy to this de-identified data that basically is just raw numbers, we're going to see really where we've been and where we're going. And patients are going to be better for it as 2021 rolls around. And so are the surgeons. And
what's next for Avalon.AI? Where do you go from here?
Yes. So I mentioned earlier that the platform is a data aggregate sort of platform. And what's really neat about it is it's not specific just to opioids. While that may affect me the most in my practice, it's going to sort of reach out now and focus on other areas, as I mentioned earlier, such as diabetes and blood sugar regulation and oncology and cardiology. It's going to really provide long-lasting and long-reaching sort of avenues for patients as well as providers. So it's something where it's really going to change, I think, the way we view healthcare in real time. And as we watch this sort of grow and expand over the next couple months and the next couple years, it's going to be something that I believe becomes standard of care in many practices.
And we will have people listening from all over the world. And if anyone wants to, find out more information about the work that you're doing, and particularly the medical community as well, what's the best way of finding Avalon.AI online and maybe even contacting a member of the team there?
Yes, that's a great question. So right now, our CEO, Chris Malter, he would be the one that would be the lead contact for you. Avalon.AI does have a website that's currently up and running, but Chris Malter is really open and receptive for physicians that are looking to get involved in this sort of outreach. His email address would be C as in Charlie, M as in Mary, at gaventures.co. That's cm@gaventures.co. And he's really the individual that got me fired up and excited about this platform. And I think he's the one that's going to take it to the next level for many physicians.
Well, one of the things that I always try and do on this Daily Tech podcast is explore areas of where technology is helping people in ways that you just don't imagine or even think about. And when we talk about opioid addiction, you just do not associate artificial intelligence with it, or for most people listening, they wouldn't. So I love how you've set the scene here, and most importantly, how technology and people have created a real solution that can help people here, especially in pain. So thank you so much for taking the time. I know it's early morning there in the US that you're talking to me, but thanks for getting up early and having that conversation with me today.
Neil, thanks for letting me on your podcast and part of your show. I think this is something that's going to help many patients, both here as well as overseas, and I'm just honored to be a part of it.
Avalon.AI is an AI company that is dedicated to developing this real-time enterprise solution that connects customers with end users through smart technology. And in germinating global ecosystems, Avalon.AI seems to be bringing together many of the world's best minds and talent to generate the greatest impact in solving worldwide challenges, with everything from COVID-19 to America's opioid epidemic all the way through its pipeline of AI technologies. And if it wasn't for me randomly Googling this, having problems with my own shoulder, I probably would still be blissfully unaware. So hopefully you've learned a few things today in the same way that I have. But I'm afraid we're out of time now. So all that's left for me to say is email me, techblogwriter@outlook.com. My website is techblogwriter.co.uk. A big thank you for listening. I invite you to join me again tomorrow. And until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.